Good morning and welcome to the PT on Ice Daily Show. My name is Dr. Trissa Hutchinson, occupational therapist, and today we're going to talk to you about home safety assessments beyond transfers and gait. Now, team, oftentimes as therapists, we get asked, are our patients safe to go home or safe to remain in their home? And we crush checking out their transfers. Can they get up and down from the toilet? Can they step in and out of the shower safely? Do they need a grab bar in their shower? Do they need a walker or a cane so they can walk around their home a little bit better? But sometimes we miss the mark in taking it a little bit beyond just the transfers and gait and actually assess how they're interacting with their home and if they truly are safe to return or remain home, or if there's interventions that we can put in place to help them get to that safe place. So team, I'm going to talk to you about the 3 M's, as I like to call them, that can help you level up your home safety assessment. First, we're going to talk about the first M, which is medications. Now, team, when your patient is in their home, are they managing their own medications? That means, are they filling the prescription? Are they taking them on time? Do they know what their medications are for? Do they have anyone that could support them if there is an error? Is there someone that is checking on them to make sure that there isn't errors occurring? Do they have someone who can actually physically go pick up their prescription if they're not able to do so? Do they have leftover medications in their home that are from maybe someone else in the family that are way expired, or maybe they had a surgery years ago and they're still holding on to those medications? It's really important to dive in and see where they're at in terms of their meds. This is a huge safety risk for our patients because, as we know, not taking our dosage appropriately with a medication, taking them with incorrect timing, taking the wrong medication, all of those different things can lead to some pretty significant and critical situations with our patients and their overall safety. So the first one, medications. Number 2, I like to refer to this as machines. So when your patient's in their home, I typically, if I get the luxury of going through their actual apartment or house, have them walk me through how they operate the machines in their home. And when I'm referring to machines, I'm talking about their washing machine. Do they know how to actually operate the machine? Can they turn it on? Are they putting the right amount of soap in the machine? Are they storing it with the door open if it's one of those front loader machines, so that they're not having a buildup of mold inside, and then they're washing their clothes in mold or interacting with mold? This actually happened to me just last week. I had a patient who was storing her door of her washing machine closed, and when we were doing our home safety assessment, when she opened that, there was this dark black looking mold filling the whole rim of that washing machine. And she was washing her clothes in that mold because she wasn't aware that she needed to keep the door open. Now, that's not saying she can't return home, but rather we did some education and put a reminder right there to encourage her to keep the door open. We also are getting her a new washing machine, or getting that piece fixed so that she's no longer interacting with mold or having her clothes washed in mold. Further, we can talk about the dryer. Does she know or he know how to operate the dryer? Meaning turning it on, turning it off, ideally not leaving the home when the dryer is running. And then are they changing or are they cleaning out the dryer filter? I know that this seems really basic, team, but having a really packed full dryer filter with all of that lint can be a huge fire safety risk. And I can't tell you the number of times that I've checked this with patients and they're packed full. It's as if they have never or have not in at least a year actually taken out all of that lint or cleaned that out. Again, posing a huge, huge safety risk. Can we put in reminders? Can we ask family or a caregiver to check on that every so often when they stop by? Moving forward with machines, think about the kitchen. Are there different major appliances that they have access to operate? And are they safe? Meaning, Do they know how to actually operate the oven? Are they storing anything in the oven that would be a potential fire safety risk if they turned the oven on and forgot that those things were in there? A lot of my folks typically will put like Tupperware containers or something in the oven. And so we have a conversation about maybe we can find a different location to store those, especially if I feel that there's a risk in terms of some sort of cognitive decline. Same goes with, do they know how to operate the stove or the stove top? Can they turn on the switches? What type of stove is it? Is there a potential risk for like a gas leak if they didn't get it lit appropriately? Or is it an electric? And do they know which burner and which knob actually correlate together? Do they know how to turn that off? And do they know that they shouldn't be storing anything on that top surface? Team, I know it sounds basic, but these are really, really important things to be checking out with your folks. Last, one of the big machines that I like to check out is your overall microwave. A lot of folks now depend on using microwaves for their meals, especially our folks that are older adults in their homes and maybe there's only one person living there, or they're independent by themselves. So do they know how to operate the microwave? Do they know what can and cannot go in the microwave? Do they know how to actually like set the time for the microwave? I had some folks one time who they didn't understand how to operate the microwave. So they were setting it for 10 minutes, thinking that they were actually setting it for 10 seconds for things like that. So really talking through safety pieces in terms of our machines. So number one was their medications. Number two is their machines. And then number three is memory. And when I'm talking about memory, I'm not just talking about a cog screen. I'm talking about how do they do with recalling their home environment? Do they know where they live? Do they know their address? If they're in an assisted living facility, do they know what room is theirs? These are key components for overall safety. Do your patients like to go for a walk outside, and are they likely to get lost, or are they likely to find their way home no problem? Are your folks in a facility where if they forget their room number, they're going to be safe and someone will help guide them back? Or do we need to put some things in place, like maybe a tracker bracelet in case maybe there's a one-off where they get confused and family is able to help them navigate back home? Do we need to get them a communication watch where they can call family if they get lost? Nowadays, even those, I know like the Meta glasses, like no affiliation here, but those Meta AI glasses, I have one individual who wears those and she has programmed in how to get home. That's typically for her actually just because she has low vision, and she can ask her Meta AI glasses to please guide me home. And so if she's on a walk, it will tell her when she needs to turn, etc. That's typically, again, just because she has difficulty reading street signs. So that's a really cool option as well. So yes, being able to locate where they live, their address, all of those things are really important. Also, are they able to understand what to do in case of an emergency? Do they know who they should call? Do they know the number for 911? Do they know how to exit the building? Do they know the procedure, and can they recall what to do in case of an emergency like a fire? For example, our assisted living facility, I know this sounds crazy, but the protocol is to stay in their room because the sprinkler system is so great that they are safer to stay in their room until a fire department personnel has come to get them versus coming out and potentially risking inhalation of smoke. Again, just a key component to go ahead and assess with your patients. Do they know what to do in case of an emergency? And then for memory, we can also think about processes in their home. So yes, we talked about transfers, gait. Can they get in and out of the shower? But can they actually operate the shower? Do they know how to turn it on? Do they know how to turn it off? Something that can be common in showers, sounds silly, but there's like sometimes there's like a button on the shower head if they have a removable head that can just like pause the water for a bit. I've had individuals who they think that that is turning it off. So in fact, the water is running all of the time and they just pause the button. And so it has caused a problem in the overall shower head and integrity because they're running the water the entire time. So, folks, it's really, really helpful to look at those processes, look at their overall memory and cognition with those types of things. We do a great job in the L2 course diving into a further cog screen. If you're noticing in these different components, such as like not able to locate their home, not able to recall what to do in case of an emergency, etc., is it appropriate to do a further cog screen to see what cognitive level they're at and determine what types of interventions are going to be successful for them? We can't just assume that if someone doesn't remember, if we give them like a little card that has their address on it, that's going to work for them. Sometimes taking it a little bit further can be super helpful. So, team, home safety assessments, we can take them beyond transfers and Gait. We can talk about the 3 M's to help level up that overall home safety so that you're the provider of choice when it comes to making sure your patients are successful in their return to or they're being able to stay in their home. So remember, medications, machines, and memory. Thanks, team. I hope you have a great day.